Better access to cheaper antiretroviral drugs and treatment has transformed the outlook for millions living with HIV. That's according to a study conducted by the United Nations Programme on HIV and AIDS, published in the UK Guardian. The average HIV-positive person is now expected to live for 55 years. This is almost 20 years longer than a person living with HIV in 2001. However, the key is to properly and consistently take one's medication. Therefore, being diagnosed with HIV is no longer a death sentence. So what's the picture in Grenada? Coordinator of the National Infectious Disease Control Unit, Arthur Pierre, says in Grenada, HIV-positive people are also living longer.
Yes, we are seeing persons living longer. In fact, our statistics during the 1990s would show that we would have had more deaths as compared to the years, let's say, from 2005 and onwards. In fact, the most deaths we have had recorded was 15 in 1993. Last year alone, we had 9 deaths. If persons adhere to the medication, adhere to the antiretrovirals, they can prolong their life.
However, Pierre pointed out that men are the ones more likely to be reluctant to take their medication.
So far, from 1984 to 2014, we would have recorded 246 deaths, HIV/AIDS related. 177 were males and 69 were females. So our men folk are not adhering to the drug regimen.
He says though one can live longer after contracting HIV, it in no way means that one should let down his or her guard, especially in the carnival season.
Even though we have medication and so that, it could give you some degree of comfort. If you're HIV positive, what is most important is prevention. Prevent yourself from contracting the virus, prevent yourself from contracting other sexually transmitted infection, and pay close attention to, what you do around the season.
The Ministry of Health will provide an opportunity for citizens to get tested at the River Sally Medical Station on Monday from 1 p.m. Ria Murray, GBN News.